Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk about orgasms or dysfunctions or disorders related to orgasm. As you probably know, orgasm is a climax at the end of a sexual experience, and it comes with contractions and the release of semen. In olden days, they used to refer to orgasm as a little death due to the feelings and sensations people get. But let's talk about what happens when there are problems related to orgasm. So if you like this video, give me a big thumbs up, click the notifications tab, subscribe to my channel, and you'll learn more about various psychological disorders. But without further ado, let's talk about the three major disorders of orgasm. So, as I mentioned, the orgasm phase of the sexual response cycle is when sexual pleasure peaks. There is tremendous tension and then release, and we see vaginal contraction, we see seminal emissions, sometimes we even see fluid release amongst women. The three disorders that we're going to talk about today, though, are either early ejaculation, which you might hear referred to as premature ejaculation, delayed ejaculation, and female orgasmic disorder. So what is early ejaculation or premature ejaculation? This is when, for a minimum of 6 months, a person ejaculates within a minute of beginning sex with their partner, and is earlier than he wants it to be. So this has to be a persistent reaching of orgasm with relatively little stimulation. And we see that in terms of every so often, it is about 30% of males report rapid ejaculation, but that's not the disorder. It has to be an ongoing thing for a minimum of 6 months, causing significant distress. So we also try and understand, well, what's the explanation for this? Largely, we see psychological factors related to this dysfunction, things like being super young and sexually inexperienced. We also see genetic predispositions. We see that if there is a harried masturbation or push towards rapid ejaculation, that can carry on into the bedroom with a partner. And we see with some people greater nerve sensitivity, and that could cause early ejaculation. Now, what are some treatments? So one of the major treatments for early ejaculation is what we call the pause procedure or the start and stop technique. That's basically where during intercourse, when a person feels, a man feels like he's about to climax, they say pause and they stop where they're doing until the sensation subsides. It's not going to be that long. It's a few seconds, and that allows the experience to continue for a longer period of time. So there's some communication in here. You would not enter or exit during this process of pause so that you can, because you're going to feel stimulation either way. So you literally stop in position. We also talk about SSRIs. Antidepressants can sometimes impact issues related to orgasm. They reduce arousal, but in the case of a person who's overly aroused, that could be a good thing because it delays premature ejaculation. So these ideas can be helpful for early ejaculation. Now, the opposite is what we call a delayed ejaculation. This is for 6 months or longer. A person is either not able to have an orgasm, a male cannot ejaculate, or it takes a very long period of time to ejaculate, and it causes some distress. This issue occurs in about 8% of the male population. So there are some techniques we talk about that we'll get to. So in terms of delayed ejaculation, it could be low testosterone, it could be a neurological issue, it could be back to what we talked about in an earlier video, performance anxiety or a spectator role. That means, remember, it could interfere with one's erection, but it could also interfere with one's ability to climax. And it could be impacted by masturbation as well, or it could come out of another diagnosis, a hypoactive sexual desire. So if you have low libido, if you have difficulty with maintaining an erection, these are going to carry through the various stages of the sexual response cycle. So what are some treatments? Well, some of the techniques we talked about, performance anxiety, we work towards reducing anxiety. You might engage in a tantric experience so that the person doesn't feel anxiety and there's no rush to intercourse. You might also increase stimulation so that by the time you get to intercourse, you will be ready to go. So these are some of the recommendations we have for a delayed ejaculation. Now, what happens when the delayed ejaculation is due to some physical cause, such as a neurological damage or some kind of injury? We might have to include some kind of drug to address this problem. The last disorder we're going to talk about in terms of orgasm is female orgasmic disorder. Similar to male orgasmic disorder, this is either an inability to reach orgasm, or an infrequency of reaching orgasm, or taking excessively long time before reaching orgasm. As with all of these sex-related conditions, they're chronic, so you need at least 6 months or longer, and it has to cause some distress. So arousal and orgasm are viewed together as it relates to female orgasmic disorder as well. So let's talk about the amount of women who report difficulties with orgasm. About 24% of women report that they struggle with orgasm. Over 10% report that they've never reached an orgasm, and another 9% report very rarely reaching orgasm. So what are some factors that are going to increase the likelihood of attaining an orgasm? If a female is sexually assertive, comfortable in her body, if she knows her areas of sensitivity, particularly related to masturbation, these things are going to help her know exactly how to achieve orgasm. And female orgasmic disorder is far more common with single women relative to married and cohabiting women. So what are some causes of female orgasmic disorder? Well, there could be a whole host of physiological problems. There could be substances of abuse. There could be postmenopausal changes related to the hormones that could play a role. It could also be linked to some other psychological factor, like a hypoactive sexual desire or a sexual aversion, things like anxiety or depression. All of these things can lead to a female orgasmic disorder. There could also be some childhood trauma that this elicits and that interferes with orgasm. Lastly, there are sociocultural factors. So when we think about the double standard for males and females, males were allowed to indulge in pleasure, and females were more restricted in their pleasure. So this idea, this theory, though, has been challenged because we see, earlier in history, sexual restrictive histories are fairly equally common in men and women, and then with or without the disorder. So other issues are traumas, relationship fears, bad memories, things like that. if there's an emotional intimacy, a person's more likely to achieve orgasm. If there isn't, they're less likely to. So these are the biological, psychological, and social factors related to female orgasmic disorder, and how do we treat this? So for the cognitive piece, we use cognitive behavioral exercises. For other aspects, we use self-exploration, body awareness, even recommend directed masturbation training so that they know how to receive pleasure. And then we've talked about hormone therapies and potentially Viagra or female Viagra, and it has been very limited research at best. So that is a very brief description of disorders related to orgasm. We talked about when orgasm happens quickly. We talked about when it's delayed or absent. We talked about the difference between males and females, and we talked about some treatments. So once again, I hope you liked this video. I hope you found it meaningful. Hit the like, subscribe, click the notifications tab. All of these things are important for YouTube algorithms, but what's important to me is a conversation. If there's anything you learned from this video, if you have a question, put it in the comment section below, and I respond to every comment. Take care, everybody.